Okay, please tell me your name and what you have done so far with Paida and lodging.
Hey, well, my name is Russ Belmare, and I've done a couple of things with the Paida. I got introduced to it, uh, probably about a year or so ago by Janine, my friend here.
Thank you.
And the first time was I was having some issues with my knees, and so she came over and showed me how to use Paida on my knee in hopes that I could avoid a partial knee replacement. Ultimately, I did experience some relief, but the bone-on-bone situation had been existing for so long that it was pretty much necessary at that time to go ahead and go through with the partial knee replacement,
Right.
which I did.
Okay.
Since that time, I've had a little bit of arthritis in the knees, and so I've been kind of using it off and on the other knee, and have found that I'm getting some relief on my right knee, which prior to a year or so ago had never been a problem.
Okay.
So I would, kind of slap it for 20 minutes or so, and then it would get sore, and I realized that the intention is that that's a good thing,
Yes.
but being an individual who typically goes to the doctor for just when I have these kind of issues, it seemed a little strange to me to continue to do something
Right.
that was hurting as opposed to feeling better.
Right.
However, after a couple of days, I began to realize that, gee, this knee isn't as sore as it was
Yes.
2 days ago.
Yes.
Okay, so I would continue to do it periodically as the knee would flare up,
Okay.
and found that the amount of pain, if you will, from just the arthritis would subside.
Great.
So that was a good thing. Okay.
Good.
Now, most recently, my most recent experience was in November of last year.
Right.
I had a stroke. It was determined that my carotid artery had some blockage, and that it had ulcerated it. In other words, it was bleeding and giving off very small clots.
Yeah.
They did some x-rays and found that I had had 4 mini strokes
Yes.
prior to that, and the only reason I knew this one was because I lost sight of my right eye. So I went into the emergency room, the stroke center, and what they did was they did ultimately they opened up my carotid artery, cleaned it out, got rid of the area that was bleeding, and in order to prevent a major stroke.
Right.
So that's healed up nicely, and I have no problems with that. But one of the after effects, for whatever reason, was my blood pressure went from being normal all the time to being elevated to not unsafe levels, but higher than I would normally be. So the typical approach in Western medicine, of course, is medication. So I went on some medication, very small, low dose of what's called toprol. And the intent of that drug is to slow down the heart rate, which should bring down the blood pressure. Well, it kind of almost acted in reverse. The slower the heart rate, the higher the blood pressure, and which is an unusual type of event. So went back to see my doctor, and he did a study,
Yeah.
a 24-hour blood pressure study, and found that my blood pressure would be somewhat elevated in the morning when I first got up, and then it would come down as the day progresses,
Right.
which is probably the absolute reverse of most people. Okay?
Yes.
So they couldn't quite figure it out either. But
Uh-huh.
again, it was not a dangerous level or anything like that. We did my heart to check and made sure that there was no issues there, and they didn't find anything. And I've never had a heart problem. Always had regular EKGs and also had stress tests on my heart, and there were no issues. Ran into Janine one day, and she said, "What we want to do is try to help with the blood flow and to try to regulate things." And did Paida over here on my left inside of my arm here, and it was the first time that I really had it done, because she did it instead of me, and I had a pretty large area here of darkening. Okay.
Like a purple color?
Like a purple color, yeah. So didn't hurt.
It was about 10 minutes.
10 minutes?
It was 10 minutes.
So 10 minutes
Yeah.
brought about a pretty sizable area there. Went back to see the doctor and checked my blood pressure, and it was normal.
Yes.
So I think I'm not skeptic, if you will. I do believe that there are better ways of healing. The body does have it's a natural innate ability to heal itself,
Right.
if you know what to do.
Right.
Okay. So, and I'm not one that's big on taking medication for every time something comes up, take this, because when you take medication, it typically only treats the symptoms and not the problem.
Exactly.
And one of the other things that can happen is you solve one problem and it creates another.
Mm-hmm.
Okay. So while I'm still on it right now, because he didn't want me to stop abruptly, he will be monitoring it periodically to see how it goes.
Good.
And in the meantime, I'm going to continue to do some of that Paida on the other side at Janine's recommendation.
Right. If you need me to help you, let me know. I will.
Yeah, and I think that's better, because when you do it to yourself, the tendency I found so far is to kind of ease up or stop, or kind of say, well, okay, that's enough. It hurts now or whatever. But I found that when somebody who knows what they're doing, when they're doing it, she has a natural ability to be able to do it to the point where it really doesn't hurt. Okay, and even after it's done, it doesn't hurt. Unlike if you were to get like a punch or something where the bruising would be sore. You'd be sore in that area.
Right.
This wasn't sore,
Good.
which I found unusual.
Amazing, isn't it?
So, being of an inquiring mind, I did some research.
Yes.
Online on Paida, and I apologize for not remembering the name of the.
红吃消.
That's correct. Yeah.
Yes.
So I read a lot about his background and the people who use Paida
Right.
as a healing mechanism, self-healing, if you will.
Right.
And there's a lot. There apparently is a lot to be said for it, and I guess a lot of it has to do with if you can believe strongly enough in something, then typically it could work with mind over matter
Yes.
being a primary consideration.
Right.
If you doubt its effectiveness, then it may not work, because
Exactly.
you have to be able to focus and believe in order for something to work properly.
Thank you so much.
So I was very pleasantly surprised with the outcome, and while I'm not ready to just start going all over my body at this point, but as I find areas, I will consult first with Janine and say, okay, is this something that we can try Paida?
Right.
And if so, we'll give it a try, because I've had 2 positive outcomes, and I expect that I probably could experience more. So I thank Janine for what she's done. She's been an inspiration, and And I'm slowly coming around to having more confidence in doing it myself. And as I see more results, then obviously my confidence level will increase. So thank you, Janine. I appreciate very much what you've done, and we'll see what happens as we move forward.
Thank you.